Yeah, so my name is Dr. Rafik Sedra. I'm one of the chronic pain consultants working at Frimley NHS Trust. I do work on Wexham and Heatherwood sides, around Wexham and Windsor and Ascot area. Just briefly about myself, I've been trained in Oxford University Hospital. I finished my training, and then I did a bit of more top up of pain training in London in Guy's and St Thomas's. And then finally, I end up in this lovely place, Frimley NHS, which is a very good hospital. I do work on the NHS and private side as well, and I'm really enjoying my job. So my background as an anaesthetist, I think, helps a lot to be pain specialist, because it's part of my job is to assess the pain. We do assess the acute pain. We do have options for people with pain. We do lots of injections in anesthetics, and this is actually help me to think, all right, what can I do more? I can do chronic pain as well, and I found it quite interesting and actually rewarding. So having someone in pain and being part of improving that pain and improve his quality of life is something very rewarding. And I think this is the main thing of doing pain as a subspecialty. We do have lovely patients as well, so it's quite rewarding actually job. Yeah. So as I mentioned in the last question, I think chronic pain patients are quite special cohorts of patients. Okay, they do have their biological part of pain, and pain is causing lots of stress in their life, which is affecting their quality of life. They will tell you they cannot do what they like to do before. They cannot sleep. They cannot do things with their kids if they have kids, or with their grandchildren if they are elderly. And then when they came to you and they tell you, right, can you help me with that? And you try to address each part of their pain, try to explain to them, my job here is not only to make you pain-free, but to get you back to the things which you like to do, to get you back to do your job, back to work, back to sleep, kind of normally, so kind of back to normal life. And then when you see yourself, you can do things about that, and they are getting back to you, understanding the pain in a bit of more depth, telling you, yes, we're doing more things, we are happier, it's you change our life. I think nothing will be more rewarding than that. I think that professionalism and being honest about their treatment and about their management. So I always tend to tell my patient that it's a lie that someone can completely take your pain off you. Okay, that's not right. We work together to manage it to a better position, to a better situation. So you need to do more things. We need to improve your life. We need to learn about pain. Yes, we treat the pain with lots of things like medications, physiotherapy. We do lots of interesting injections, which really helps the patient. But they do value the honest opinion, and some of them they don't need for example, injections. I explain this to them. It's not for everyone. Some of them will need to be referred to another specialty, and I mentioned this straight to them. There is no point of wasting time, and do things which we're not gonna help. So they really appreciate, I think, the honest opinion and being open about things and giving them management will suit and tailor everyone, depends on his condition and depends on his pain.